So, historically, when people have thought of sports psychology in particular, the focus has been on performance enhancement. What we're finding, though, and that's where kind of things have changed a little bit, that for many folks, especially young people, it's all the other stuff that's going on in their life that's having a much greater impact on their ability. The fact that we're able to really identify other mental health concerns, again, anxiety that is not specifically related to performing, but they've got a high level of anxiety as it relates to grades or maybe food or whatever the other stuff might be. I kind of became the landing spot for anything that might come up in the course of a primary care evaluation, recovery from injury, return to sport from those things, and a much easier kind of transition to talk about mental health with somebody when they can go across the hall or down the hall and see the sports psychologist. The first appointment is really information gathering. I'll go through some family history, whether there's medical history, some mental health history, what the family looks like, what schooling looks like for them. It's what we call a full psychosocial evaluation, which will funnel down towards a point where we get an understanding of, okay, what makes this person tick a little bit, what motivates them, and really what are they hoping that they can accomplish out of some time together. And it's really about functioning. How can we help you get back to doing the things that are important to you, or dealing with some of the things that perhaps maybe they didn't realize were affecting their functioning. So the first visit is really get the information and then start to develop a direction and that is guided by what they want to do.